So do you feel pain in the back or just down the leg?
Just down the leg and
just down the leg.
A little bit on the side. In 2019, I felt like in a small hole like this.
Yeah.
Like I was walking on the side up in the ivy,
Uh-huh.
and I fell in that hole, and I hear something like cracks on my hip.
You heard it crack.
Yeah. And then after that, it got worse and worse and worse. In 2022, I have a car accident, and I went to the chiropractor for like a year, and it doesn't work, so they decide to send me with this doctor, and they want to do the surgery. And I say, well, if that's the best option that I have, let's do the surgery to see. I feel better.
Ooh.
I was walking with pain, most of the time.
You were walking with pain, you don't feel as much now.
Mm. And they say, well, you're getting good, you can start to do some work.
Uh-huh.
And then I started to do some work.
And it made it bad.
And it makes everything worse.
So do you feel pain in the back or just down the leg?
Just down the leg and
just down the leg.
A little bit on the side,
on the side, on the hip area,
yeah,
right?
The hip area.
Okay.
But what happened to me, like in 2019, I felt like in a small hole like this.
Yeah.
Like I was walking on the side up in the ivy,
uh-huh.
and I fell in that hole, and I hear something like cracks on my hip.
You heard it crack.
Yeah. And then after that, it got worse and worse and worse.
And this was in 2019,
yeah.
So about 5 years ago.
Almost 5 years.
Almost 5 years ago, you
yeah.
step in this hole, you felt this,
and then
you went to the doctor.
And then I went to the chiropractor.
Yes.
And he helped me a little bit, and then I started to feel better. And 2022, I have a car accident.
Oh.
And somebody hit me.
Made it worse.
Hit me on the back.
Ooh.
And then it makes everything worse. And I went to the chiropractor for like a year, and it doesn't work, so they decide to send me with this doctor, and they want to do the surgery. And I say, well, if that's the best option that I have, let's do the surgery to see because they were like, oh, it's like 95% that you're gonna be better.
And so they did this in June.
And they did this in.
When you were done in June, you felt a little bit better, and then it got worse, or you never felt better?
I feel a little bit better for like 2 months and a half.
2 months and a half, you felt better, and then it got worse again.
And then I got worse again.
Was it the same kind of pain you had before, or this is different?
No, this right now is worse.
It's
but
worse.
Same leg.
Same leg, but it just got worse.
Yeah, it just got worse.
Surgery got worse. Okay. And where did you see me on, like YouTube or Instagram or one of them?
TikTok.
TikTok.
I was like looking for someone that.
Yeah, that does something different,
yeah.
right? All right, we'll see. This is a tough case. This is a very tough case because you already have a problem with the disc there. When I look at the X-ray, it doesn't look that bad, but on the MRI, it's worse. You have a disc problem there, but they shaved it off, right?
Yeah, they shaved
it off.
Yeah.
So you still have all your bones, which is good. Let's see. I mean, have you had any other surgeries besides that one?
Mm-mm.
That's the only one.
No, they did it like the epidural.
Yeah.
They did that like 3 weeks ago.
Okay.
It doesn't
Nothing.
work.
Didn't do anything.
Anything.
Ooh, this is going to be a tough one. I hope we're going to get some good result today. Okay. So anything you do make it feel better? Anything at all? Is there anything that you do that makes it feel better?
Well, I have to lay down in the floor, like.
It makes it feel a little better.
I have to be flat.
And then it feels better.
It feels better.
Okay.
Yeah.
And most other things make it worse, like bending, twisting?
I cannot bend. I cannot see it. I mean, like right now, because all.
Yeah, the therapy?
Yeah, it helped me.
It helped you a little bit, so you can sit now for a little bit. Okay. So most things make it worse. Mm-mm. And just laying flat makes it better, right? What does it feel like? What's the pain feel like? Is it sharp?
Yeah, sharp and
like real fuerte,
sharp,
right?
and like electricity going down.
Electricity going down. Does it go all the way down to your feet?
No, all the way down here.
To the back of your calf.
And it hurts like my knee.
Your knee, right to the knee. Okay. All right. Woo-wee. All right. And so you had a little fall, then you had a car accident, and this is what happened. Prior to that, you didn't have any problems. No problems at all.
Never had back problems before.
Wow. Okay. You saw my videos. What did you think when you saw my videos?
Well, I said, let me
give this a try.
Yeah, let me give this a try. They don't want to help me out. They say, no, this is too soon. But I'm been struggling for the last 3 weeks. It's been so bad for me.
Yeah.
I can't even drive.
Oof, can't even drive. All right. Let me see. Stand up for me if you don't mind, okay? Can you bend at all? If you bend, does it hurt? Hurts there?
Yeah, it hurts my leg.
Yeah, come on back up. Go backwards.
No, back.
No problem, it's okay.
No problem.
To the side? To the other side?
No.
Give yourself a hug. Kind of turn. No problem?
No problem.
Okay, it's just going forward. It doesn't feel good. Okay. You got any questions for me?
Yeah.
You ready to do this?
Ready.
You ready? All right, let's do it. Let's lie on your back. When you're laying here, are you okay?
Yeah, I feel great.
You don't have any pain right now?
No.
Laying flat like this, you don't feel any problem?
Yeah, most of the time, that's what I do in my house. You know, when I have a lot of pain, I just lay down on the floor.
Yes, and it feels better.
It feels better.
Right now, do you feel the tingly?
No.
You don't feel it at all?
No, I feel like a little bit. Maybe like 1 to 10, like 2.
You only feel it 2?
2, yeah. That's
maybe when we're done, it'll be 0.
I hope so.
That's what I hope so,
yeah.
Right? So we're gonna do a bunch of things. A lot of things I do, when I decompress you from here, you're gonna feel down here. So I tell patients, you might have seen my videos, I tell them, oh, this is not gonna hurt, this is not gonna hurt. This one might pinch you a little bit. Mm-hmm. I'm not gonna lie to you. Yeah. It's not gonna hurt, but it might be like, ooh.
Yeah,
ooh.
I'm going to feel it.
You're gonna go like that. It might feels like a little bit worse, but it's gonna be better. You just have to breathe through it. It won't last. Almost like if I give you an injection and just like that, you go, for a second, and then it's gonna go away. But see, our mind thinks if it hurts, it's like, oh, it hurts. It's gonna be okay. Yeah. I'm gonna get some pressure off of there, okay?
Okay.
Just relax here, okay? We're gonna go like this, good. Let your head relax, good. Okay. Let your whole head, deja caer todo el peso de su cabeza en mi mano. Speak a little Spanish too, right?
Oh.
Dios mío. Woo. You never felt one like that, right?
Never.
Wow. That was a lot in there. Perfect. Let your head relax. Wow. Wow. That feels good, right?
It feels great.
We're going to bring this ear to this shoulder, okay? Just a little bit. Very good. I'm going to relax this one here, okay? Relax that one there. Good. Good. Perfect. Excelente. Keep your mouth closed. Cierra la boca. Juntos los dientos, okay? Just relax here. Good. I know you've been suffering. You know that something is putting pressure on those nerves. That's why you feel it going down the back of your leg. We don't need to make it perfect. We just need to take some pressure off those nerves so you feel better. All right? So just open your mind to just letting it all go. Just relaxing. I know you're hurting, but this is going to help, okay? Just relax right there. Good. I'm going to put my hand here, and I'm going to pull this way. All right? Just relax. Make sure your mouth is closed, teeth together, okay? We're going to lift up a little bit. Did you see God?
I feel better.
You feel better already? Just let that relax. Let it go. Let it go. Woo! You feel taller?
Yeah, I do.
So this has really affected your ability to do your work.
Oh yeah.
You can't do it.
Even life, you know.
Oh yeah. Good. Ooh. Crunchy. We're gonna come over to your side just a little bit. Bring the chin down like this. Perfect. Stay like that. Stay like that, okay?
Okay.
I got you. Stay like that. Stay like that. Oh. Open your arms. ¿Cómo te sientes?
Yeah.
You can breathe better now, right? Somebody's happy now.
Feel better.
Feel better?
Yeah.
Does it hurt here?
No.
Does that hurt? Doesn't hurt at all. Nothing. Good. Here? No pain. Most of my patients, I'm not kidding, most of the time, the right leg is longer. Yours left leg is longer. That means you have more problems on the left side.
Yeah,
that's the side, right? Yeah. The right hip is tight, making the left one have problems. Are you left-handed?
No.
You're right-handed?
Right-handed.
Right? Okay, my friend. Try to let this relax, okay? See the surgery mark right there? Little surgery right there. Hang in there, okay? Relax this one, really good, okay? Relax it good. Oh.
Feel all the way to here.
All the way up to your whole body, right? Yeah. You feel the whole thing. Nobody believes it. They think, oh no, it's just for the TikTok. It's not for the TikTok, right? Can you breathe out loud? That feel good. Then I'll come here. Okay. Here. Wow. Oh. Mucho. How you feel?
Bien.
Feeling better, right? Now look at me. Bring your chin kind of up. Like that. Perfect. All right. So I'm going to pull a couple, just so you see what it feels like. It should feel good. Feel it? Feel good?
Mm-hmm.
Good. You've been suffering. There's pressure in there. We're going to try to get the last little bit out of that pressure, okay? On this pull. The more you relax, the better. So just breathe any way you want to breathe. It doesn't matter. Just breathe. And relax. Good. And on 3, I'm going to pull. Okay? I'll count it down. So I'll go like this. This one's number 1, like that. And then relax. This one, number 2, like that. And then relax. And then number 3, like this, and then. Oh.
Feel that all the way down.
That's what I wanted. We had to do it at the end to loosen it up, right? It was more loosened up. You felt that all the way down to the lower, right?
Yeah.
How's the leg feel?
Feels good.
It's mejor. It's better, right? See, though, you were so off. Now you're balanced, okay? You came in crooked. Now you come back balanced. Let the body do the healing. The body is what does the healing. Not me. Your body does the healing. When it's not in alignment, it's still healing, but not as good as it can. So now it's going to be better. I hope it just transfers over to every part of your life, not just the physical, emotional, psychological, spiritual. Everything is better, okay? Is it sore in here at all? A little bit, no? Not too bad. Feels really good, right? How about down here? It's a true test when you stand up, right? Go slow. So your back really doesn't hurt a lot. It's more the leg, right?
The leg.
Yeah. Come on, stand up. See how it feels.
I mean, I still have some, but I feel way more better, you know?
Much better, right?
Yeah. I
You
feel like loose.
Yeah. You feel so loose.
Yeah.
You see how this will help you.
Yeah.
We do a few more times, it's going to get better and better each time. It's a big difference, right?
Yeah.
Yeah, you feel more loose and more relaxed, right?
I can walk better.
You can walk better, huh?
Yeah. I was walking with pain, you know, most of the time.
You were walking with pain, you don't feel it as much now. You know something happened good, right? And nothing hurt that I did, right?
No, at all. I thought it would be worse, you know.
You thought I try to tell the patient maybe it's going to be bad, and then when it isn't, it feels better. You know what I mean? Just so they're prepared that they're like, oh, that wasn't bad. I'm like, yeah, I hope it wasn't going to be bad, but you feel a difference though, right?
Thank you. Appreciate it.
You feel tall, huh? That's good, man, huh? I'm happy you feel better. This guy we saw the surgery. Surgery didn't really help, made you feel worse, right? Unfortunately. I'm not against surgery. It just didn't work for him. So he came today in a lot of pain going down the leg, right? And when you were walking, you felt it much more. You feel a substantial difference, right?
I feel like 1.
It feels like a 1 out of 10. So, I mean, this is amazing because this is a very difficult case. He's already had surgeries, had a discectomy. You still had pressure in there. You had nerve irritation going down your leg. So this is not something we can fix in one visit, but you feel like this is going to really help you, right?
Yeah.
It's going to help.
Definitely I'm going to come back.
Good. What surprised you, if anything, that I did? Anything surprised you? Were you surprised?
I mean, everything, basically, because, you know, most of the other place where I went, I mean, they do the crack, but they don't do like this much, you know. I don't feel like that deep.
You didn't feel that deep?
No, it went like really
deep. That's a good point. That's why I tell people, I want to know why they're surprised. And he went to other chiropractors, but this is deeper. And it didn't hurt, even going deep. Because a lot of people say, oh, that looks like it hurts. It doesn't hurt, right?
It doesn't.
It feels good, right?
Yeah,
feels really good. That's awesome. That's awesome. So that's the difference. We get a little deeper, but I really think I can help you. I think I can help you. I'm going to work on it. All right? Hey, I'm Atl Cracks with Dr.O. This is not just for TikTok. It's for you that's suffering out there. What are you waiting for? It's not going to hurt. It's going to feel better. Okay? So come on in. Don't be hurting. This is the best crack in town. I'm Atl Cracks. We'll see you next time.